Many people are familiar with Viagra and Cialis and its benefit for those who are suffering from sexual dysfunction. But many are not aware of the plethora of other benefits, such as cognition benefits, athletic performance, and overall hormone optimization that comes with using these phosphodiesterase inhibitors. And today I want to go ahead and break down why one might consider using a Viagra versus why someone might use Cialis. So we're going to go ahead and talk about why someone would use it for sexual dysfunction. We're going to talk about the mechanism of action of this medication and why someone might use it for athletic performance. We'll also talk about optimization of administration and also some side effects and maybe ways to mitigate them and how I've used these in my clinical practice. So one of the main things people always want to know, which one is going to be better for sexual dysfunction? And the quick answer for that is going to be Viagra. That is its brand name. Generic name is Sildenafil. And the reason for that is it has a shorter half-life, around 4 hours, and usually can kick in anywhere as quick as 20 to 30 minutes. Cialis is the brand name. Generic for it is Tadalafil, has a much longer half-life of 17 to 18 hours and takes an hour or two to kick in. So if a guy is really suffering from sexual dysfunction, I will often recommend you going first with Viagra. It's much more potent. It hits much harder. Now, with that being said, you're more likely to have side effects with it because it's overall more potent. Think about something like alcohol, the difference between drinking a beer or having a shot. And what's funny about Viagra is it's a medication that was originally developed for pulmonary hypertension. They found out that a side effect was that it helped men with their erections. So the quick answer, if someone's suffering from sexual dysfunction, Viagra is most often going to give them the quickest and best results. I do see, though, that Viagra has a tendency to give side effects more often than using a Cialis. The other benefit of using a Cialis is that it's in your system much longer. So if you've seen the commercials, often they say things like it's ready when you are. And a lot of guys, if they're having sexual dysfunction, the mental emotional state that affects the sympathetic nervous system can definitely make things more difficult. And it can build up anxiety. If a guy is wanting to be ready to perform, he gets anxious and then he takes the Viagra and he's waiting for it to kick in, waiting for it to kick in. Where a Cialis, you're usually taking daily and a small amount. And sometimes that can put guys at ease and make them less stressed. And one of the jokes I tell guys, if you're walking in the woods and you see a bear, unless you're attracted to bears, it's not a great time to get an erection. It's time to run. And that's how our sympathetic nervous system works. When we're in the fight or flight, the blood vessels to our internal organs shrink and the blood vessels to our brain and to our muscles open up, shuttling that blood to our brain and to our muscles. And on the opposite end, we have the parasympathetic nervous system, which is the rest and digest. So in order to eat, in order to breed or breed, rest and digest, we need to be relaxed and feeling good so that the blood can return to our internal organs. So short answer, Viagra is going to be more potent, but often Cialis can give us a better long-term with less side effects. And before we move on, so what are these medications? These are phosphodiesterase inhibitors, meaning in our blood vessels, we have nitric oxide. That is what is used to help our blood vessels expand, and they helps keep our blood vessels clean. Phosphodiesterase comes in and kind of eats that up and causes our blood vessels to shrink. So we're using a double negative here. We're blocking the thing that makes our blood vessels shrink. And in doing so, that is going to increase blood flow. Now, up until this point, like we said earlier, the drug was originally invented for pulmonary hypertension. Another side note, Navy SEALs and other forms of people who do deep diving are known to take phosphodiesterase inhibitors as it helps them deal with less amount of oxygen. As the blood vessels have expanded, that allows for more oxygen to be delivered throughout the body. And so what we find in these phosphodiesterase inhibitors, we get more blood, and that can be to your brain, that can be to your muscles, and that can also be to your sexual organs. So let's talk about other areas. Cialis, Tadalafil has become more well-known for its benefits outside of sexual performance, specifically in things like Alzheimer's. More and more research is starting to show that Alzheimer's is a disease of poor blood vessel health to the brain. Having poor blood vessels decreases the amount of blood that is carried there, and there are currently more and more studies coming out showing that Tadalafil, aka Cialis, can help with cognitive decline in areas like Alzheimer's and dementia. Most people who are in the longevity space or in the athletic performance space, like I said earlier, something like a Navy SEAL or even a bodybuilder. Many bodybuilders will take Cialis before they go on stage. This opens up their blood vessels and this helps them be more vascular on stage. Also, they will take it before working out as the increase in their blood vessels muscle diameters increases blood and nutrient delivery to their muscles, therefore giving more nutrients and helping them have a better workout, thus resulting in more muscle growth. Now, another area that's very exciting is there seems to be some research that Tadalafil can help with hormone optimization. Cialis Tadalafil is having more research show it increases the androgen receptor density or sensitivity, meaning that testosterone, when it's working on your cell, is actually more potent in the presence of Tadalafil. There's also some research showing that Tadalafil, aka Cialis, helps optimize the testosterone to estrogen ratio. Now, here on my channel, you know I'm a big fan of estrogen, but I like it really in a ratio of testosterone to estrogen. And it seems like Tadalafil really helps put that testosterone to estrogen ratio in the correct spot by slightly modifying aromatase, the enzyme that takes testosterone and converts it into estrogen, right? Aromatase, think flour, estrogen. Now, these areas are more well studied and more well used in Tadalafil, aka Cialis. There aren't as many people using Viagra, aka Sildenafil, in these areas. So while they may work, but because Tadalafil it gives us less side effects and works over a longer period of time, more often people are choosing to use Tadalafil, aka Cialis, in these areas of longevity and performance. Another area that's becoming exciting is the change from going from just an oral tablet to something like a sublingual troche. Most often when we take things orally, we can lose some in the digestive tract. Not 100% of all supplements or medications that we take get completely absorbed. And not only that, once things are absorbed into your blood vessels, they go straight to your liver. A lot of them get detoxified. Some of them can lose 20 to 50% of whatever is absorbed. A way we bypass this is by making it either liposomal, or many people will put it in a liposomal troche that can get absorbed underneath your mouth. In your mouth, you can absorb medication straight into your blood vessels, and that's right next to your brain. So when we think about Tadalafil and its use for cognition, it would make sense that getting it absorbed right in your mouth next to your brain would be more potent, and it would be absorbed and used more quickly than having it go through your digestive tract, through your liver, and then being distributed systemically. So often in my clinical practice, we really advocate for the troche route, which looks like a little starburst, and then you put it underneath your tongue. It slowly dissolves, and again, it gets absorbed in through your mouth. Now, not all of it. You will end up swallowing some of it. Then you're probably getting absorption in two ways. So you're going to get some absorbed now, a little bit later, and that's probably overall a better thing. Now, dose-wise, what are we looking at if we have a Sildenafil Viagra? Most often, you're going to do something like 25 upwards to 100 milligrams. I have gone higher than that when some of my patients, at that point, you're really using it for sexual dysfunction. And there's probably some other areas that you're needing to look into. If 100 milligrams of Viagra isn't doing it, you definitely need to have your whole health checked out. On the other end, if you're using a Cialis, aka Tadalafil, most doctors will start somewhere at 10 to 20 milligram. Now, I'm really in favor of microdosing. Doses as low as 1 to 2.5 milligrams, and starting that out maybe 2 to 3 times a week, especially in younger, healthier guys who aren't using it for sexual dysfunction. If they're using it for prevention of Alzheimer's and dementia, they're wanting that extra edge in the gym and overall more blood flow. Now, what we do know, nitric oxide really helps with aging and longevity. So to me, it makes sense to be using a little bit of Tadalafil from time to time. Now, again, this is a nuanced situation. You should be working with a healthcare practitioner. It's not like everyone everywhere should be using this. There's a time and place, and you also have to consider side effects, costs, and a variety of other things if you're going to use these medications. For instance, both of these can lower your blood pressure. So if you're on a blood pressure medication, stacking these together could technically send you hypotensive. Now, very rarely does that happen, as the blood pressure lowering effects of both these medications isn't great, but it's still not something you should be toying with without the help of a healthcare practitioner. Now, we really haven't talked about the side effects of these, and this is why I have a tendency to use Tadalafil more often. Viagra, we have a tendency to see more side effects. One in particular is going to be like sinus pressure, a headache, and that makes sense. We're opening up the blood vessels, so it seems like we get more blood flow into the head, particularly in the brain, and often on high doses, I hear from patients, ooh, I have like a headache, I have sinus pressure, and that's most likely likely due to the increase in the blood flow. Another thing that we often see is acid reflux, aka GERD, where a guy will take either Viagra or Tadalafil and then they get heartburn. While it may not seem like an issue, especially in short spurts over a long period of time, it can not be fun. And that's why I really advocate for using something like a Tadalafil, especially in a low dose, and then we can work up if we're not getting symptom relief. So again, another area of nuance. And then very rarely, some guys do get color changes. Sometimes they get floaters in their eyes. Again, this is probably having something to do with the increase in blood flow to the brain, messing with your optic nerve, and particularly in your eye. Often these side effects all go away when guys stop the medication. So all in all, looking at both of these medications, the quick and dirty is going to be, we're using Viagra in situations of sexual dysfunction, and we're using Cialis in situations of overall health optimization in men. Now, if you use these two, or maybe you've used another form of phosphodiesterase inhibitor like a Levitra, or maybe you just use beetroot extract or arginine and citrulline, I'd love to hear your feedback if you found something that's comparable in the comments below. If you made it this far, I think you'd enjoy this video. And until next time, stay vigilant, my friends, and God bless.